happy to do it. I think there's a lot of topics that a lot of people probably want to hear about, and so my goal really is to give whatever information you guys would like to get out of the next 30 to 45 minutes. When Tara and I talked about the flyer, we saw that there are a lot of different topics, and it can go a lot of different ways today, whichever way you want to. I am fine talking about a lot of different things. So I've been a physical therapist for 18 years and an exerciser for much longer than that, and had a lot of good training partners and a lot of people that read a lot of research and go through a lot of things with it, a lot of magazines and articles. So one of the things I thought that I'll kind of start it off. If you guys have questions, feel free to interject, and we can spend more time on these because there's a lot of different topics. So one of the things that I think that we need to talk about is important is when you're getting involved in a training program, or most people already into the training program, it's about starting gradually and then working up into whatever stress level your body is at. So for a new runner, adding 1 mile, going from 1 mile to 2 might seem like a lot, but for someone that's in their marathon training, that might be 15 miles is a lot. Everything is basically going to come down to adapting to what is the level of stress that your body can handle. If you gradually build into whatever amount of stress is applied to your body, you'll be able to handle it. It may be a type of progressions where it is on intervals. It may be endurance-based. It can be different types of terrain. It can be different kinds of footwear. But all of those things have to do with the gradual progression according to where your body is. Also, what is the age of your body? So for someone that is less than 40, they typically, if they're training consistently, they're able to train consistently 6 days a week most of the time. For someone that is 40 and over, typically they need to take 2 days off a week instead of 1, depending on what their level is. During those days off, we talk about having active recovery. Active recovery can be something like going out and playing tennis. It can be something fun that lets your mind and body completely get away from the same stresses that it is normally going through on a consistent basis. So those can be a whole variety of different things, but it's always important as you're setting up your programs to try to set up some targets to get you to your goal, but you have to listen to what your body is telling you on those targets. If the targets can't become more important than the health. The targets are just a way to try to stimulate you and motivate you to get to those points, but they can't be the end-all be-all on the targets. There are a lot of things that can, ambitious goals, often can lead you to ignore pain and get you to the point where you are letting small injuries become chronic injuries. Most injuries, the hardest injuries to treat are chronic injuries. It doesn't matter if we're talking plantar fasciitis with your feet, if we're talking IT band tendonitis with your knees, knee pain, patellofemoral syndrome, Achilles tendonitis, back pain, hip pain. The hardest ones to treat are the chronic ones. If we get patients in on a consistent basis that are within 3 weeks, those are the people that do the best, the fastest. So what is a normal pain? A normal pain is soreness that comes on gradually associated with your exercise, or that doesn't linger more than a couple days when you're done. A normal pain should be something that's kind of somewhat dull. It probably shouldn't exceed much more than about a 3 out of 10. The pains that we're looking for that you would probably look to do more treatment of are exceed 3 out of 10. They're like a very consistent type of pain. Like typically you can pinpoint where it is with one finger. You can say, it always hurts right here, or it always hurts right here. Those are the sharp pains that come on very quickly or very consistently. It's always 6 miles into my run, I start to feel this. And it's always the same thing. I've had this chronic hamstring that's been bothering me for the last 2 years because of this. those are the things that you would say are the not normal, that you need to probably look at some of the other factors that are going into it. There's a lot of myths, I think, that go along with training. One of them is that recovery is a break from training. Recovery is not a break from training, it's part of training. The only way that you're going to successfully train and not continue to be injured is that you need to schedule in when your breaks are. Whether that's 1 day off a week or 2 days off a week, or that you're going to have intervals one day and that you're going to go long one day, and that you're going to have a recovery of you're going to cross train. So if you're into the mid-40s and up with it, you may need to take, or a new runner or a new exerciser, you may need to take more days of cross training because your body can't handle the stresses of running 5 days a week. You might need to do elliptical 2 of those days and running 3 until you get where you can handle it. Or you might need to have that active recovery of just doing some other things like doing a swim or something else that's kind of different than your normal, that you're still getting cardiovascular benefit from it, but it's different stresses than your original intent. Second one is, and another thing that goes with the recovery is, typically as you're building with your endurance sport, what you want to look at is about every 4th week that you need to take a lighter week until you start hitting about your mid-40s. Then normally you should go about every 3rd week, should be a little bit more of a step back week. So instead of going 3 weeks forward, 1 step a little bit back, it would be 2 weeks forward, 1 step a little bit back in order to build that comfortably with it. Another myth is that you need to push through the pain. Muscle soreness should normally be easing, and it shouldn't be something that wakes you up at night. It shouldn't be something that's considered sharp, and it shouldn't be in the same place all the time. So pushing through pain, at some point you need to start asking yourself, why is there pain? And then there's a lot of different factors that we're going to look at with it, and then what are some of the treatment things you can do with it. The third thing that I think a myth is that you can zone out during a run. You can put on your music and you can zone out. While one of the benefits of running or bicycling or whatever endurance sport you want to do, while one of the benefits is that it's a stress reliever and it lets you get away from some of the other things, when you're running or bicycling, you need to be concentrating on what you're doing with this. The form is the key for both improvement and not to be injured with it. So when you're running, do you hear both feet the same? Is one of them quicker than the other? Does it have more of a foot slap on it? Are your arms swinging symmetrically with this? Is your lean forward or is it back? Do you feel one hip dropping with this? Are you having other different unusual things where you see one arm is going one way and one is going the other with it? Are you striking with your heels? As you get tired and you want to go faster, are you trying to take longer strides? Are you taking shorter strides? How high is your heel kick? These are all things that, as you think about them with it, you can improve, and as you work on your cadence. How many people count cadence while you're running? What's the ideal cadence while you're running?
180.
180. How many people do that? Very, very few. Even elite runners say that they struggle to be able to get 180 with it. So to count every other step for 15 seconds, multiply it by 2 and then by 4. It's just a quick way to get an idea of what your turnover is. You know, that longer strides often will give you more impact, and while you may feel like you're going faster, they're going to put more compression onto the rest of your body, which makes you less efficient. You know, some studies will say that it's 2 to 3 times your body weight. Other studies will say that it's 4 to 5 times the impact. And so if you're 100 pounds and you have 4 to 5 times your body weight going through, that's about several tons per hour on this. So if you can decrease that even by 20 to 30%, you've made yourself much more efficient, less susceptible to breakdown with it.
Where is the ideal place to strike?
The ideal place to strike is about mid-foot to the ball of your foot.
Okay.
There's a lot of talk right now that's shoe wear and footwear with this. So there's been this whole minimalist revolution that's been going on. So for 30 years, running has been really taking off, and there's been a lot of talk about running shoes are going to make everybody better. They're going to have fewer injuries. You got to get you have a high arch that's a real rigid foot. You need to get a high arch shoe. If you have a low arch, you need to get a real more of a a little softer shoe with it that's going to meet your arch with it. There's all these things with it, but in 30 years, do we have more or less running injuries? More or the same? So have the shoe companies really helped with that? Doesn't look like it at all. In fact, there was a study where they just have done in the last few years where they taken intentionally mismatched foot type and arches, no increase in injuries. So the whole, we're going to get you on a treadmill and watch how you run and look at your foot with this and see how it goes, is probably not really very effective unless they've got a slow motion camera. Even the top guys that evaluate form will say you have to have a slow motion camera to even be able to tell whether you're midfoot striking or heel striking with this. And what happens if you give a shoe that's got a lot of heel cushion, you typically can't feel your heel strike, and so you become more susceptible to want to heel strike. So the benefit of the minimalist shoes is that you feel the heel strike, and so it has more pain with that, and so you typically start trying to weight strike on your midfoot, rolling onto your toes, and therefore having to shorten your stride. As you shorten your stride, you're getting a quicker turnover with this, and so therefore more efficient. They've done another study though, where they looked at it and they said, hey, while you're running, we want you to really concentrate on a quicker turnover, softer landing with this, concentrating on striking with your midfoot. They found that people were able to take 30 to 40% of the stress off of their heel and their rear foot striking, which is about exactly what the minimalist shoe does. So I don't think you have to be in a minimalist shoe in order to change what your mechanics are with your running. You just have to concentrate on what it is. Again, you can't zone out. So if you can concentrate on getting the turnover and a midfoot strike, you can become just as efficient without having to do the minimalist shoe. Minimalist shoes, I would also say, again, it's just like what we said earlier, as how much can your body take? If someone has plantar fasciitis, and it's one of the common injuries we hear all the time, plantar fasciitis is when you have the arch of your foot, the calcaneus or the heel, you have your long and short plantar ligaments that come up to the long bones in the midfoot that are called the metatarsals. Every time your foot comes down, it collapses. As it collapses, it stretches those long and short plantar ligaments. So you can tear those ligaments and that plantar fascia, and therefore we call it plantar fasciitis, inflammation of that connective tissue. You can tear that either by a sudden push off because you haven't done a nice warm up to get things going, or you can do it because of repetitive type stress and trauma from it. It can be because you stand all day on it, it's doing this, you walk all day, you've increased your miles more than what your body allows you to do. It typically occurs in people that have flat feet, but all of those things you can get. There's people that have had plantar fasciitis, severe cases, that can run in minimalist shoes, which you would say there's no way they could do that, because anybody that's had plantar fasciitis will tell you you need to put your shoes on 100% of the time and try and support that arch so that it's not pushing down. Because those first 2 or 3 steps in the morning kill you when you first try to walk with this, or after you've been sitting for a while. Stairs hurt when you do it, but what they found is that people, if they've done a gradual progression and they want to get into the minimalist shoes, they can come home every day, take their shoes off, walk around as much as they can for a week or 2, then maybe they can start doing a quarter mile in a minimalist shoe, then put on their regular shoes with some arch support for a week or 2, then they can do a mile with the minimalist shoe, then convert into a traditional shoe, and they can just keep altering that ratio with it. So if the stress is applied gradually, your body can adapt to what it is. It's just you can't put on a pair of minimalist shoes and think you're going to go run immediately and feel good with it. You know, the first thing that people are going to feel when they get into a minimalist shoe is that they're going to, because they're going to all of a sudden start striking on their midfoot instead of their rear foot. When you strike on your rear foot, your heel hits, and what controls your foot slap? It's your anterior tibialis muscle. It's right on the front. It does an eccentric lengthening contraction, and it controls. That's why people get shin splints sometimes, especially when they do a lot of downhill running, is they get shin splints. Well, as soon as you go into a minimalist shoe, you're no longer heel striking with this. this so you're not going to get shin splints because you're not having to decelerate your foot slap. But what you end up having to use a lot more is your calves, and so people initially typically complain of calf cramps or calf spasms with that, and so they get a different type of injury, which might lead more into Achilles tendonitis. So the Achilles tendonitis, then there's certain ways you would go through and treat it as well. That's where we've got some of the fun toys on the Achilles tendonitis. But the Achilles tendonitis, just to give a quick thing on it, is the Achilles is the thick tendon that's on the back of your heel. It has your gastrocnemius and your soleus muscles that both go into it. The one set of the inside and outside of your gastrocnemius actually cross the knee. The soleus do not cross the knee. So if you're going to stretch some of the calf muscles with it, it's important to stretch it both with your knee straight and also with your knee bent, because there's two separate muscle groups that feed into the Achilles. So there are active stretches, there are passive stretches, but good form on most everything is important. Keeping your heel down, your knee straight, and gradually coming into a comfortable stretch and hold is what you're looking for with this. You can do this either just standing and keeping your heel down, where you're doing it with the gastroc where it's straight, or then you can put the gastroc on slack by bending your knee and then getting the stretch down lower, which is going to be in the soleus. You could do it on a stair, where when you're standing and you're just lowering down with your knees straight, or with your knee bent. You could do it with a belt. This isn't a belt, obviously, but where you're just kind of pulling back with your knee straight or with your knee bent. It's the same principle, whichever way you're going to do it. So that's another one of the injuries that I think that a lot of people will see. That's a very common type injury. People that get an Achilles or a calf strain, another thing that they might want to look at with it is initially, when you get a muscle strain, muscles have these actin myosin fibers that are running parallel, and they usually have about a 50% overlap. When they contract, they ball up, they get stronger, and then they relax, and then they stretch, and then they come back. So when you get a tear of a muscle, what typically happens is you're tearing these intermuscular crosshatches. So when they tear, they're going to try to heal back. If you don't do anything, if you just leave it in the shortened position and say, oh, I'm going to do nothing, it will heal, but it will heal back in like a burlap bag. It'll kind of like a real unorganized matrix with it. So they've gone through and done studies where they've taken rabbits and they stretched their hamstrings until they tore. And then they put one group of rabbits in one box and they didn't move, and they took the other group and they put them on a machine that kept moving. And when they were both healed, then they went through and retore them to see what it took to re-tear them. The group that they kept in the box without movement, as it recovered with it, tore very easily and with not very much motion. The group that was kept moving had a lot more flexibility and then took a lot more force in order to re-tear. Because when they looked at them under the microscope afterward, all the fibers were lined up, because when you keep moving in a subtle way with it, the fibers start to line up, which is exactly the point behind when you have a muscle tear, that you keep moving lightly in the movements that you want to restore, and that you do it with some massage. Massage typically goes through and helps those fibers to want to line up a little bit more. So that's what we're looking at. So initially, you would, with an Achilles injury, you would take some pressure off. You might go through and get some heel lifts, like a 3/4 or half, 3/4 to 1.5 inch heel lift if it was a bad heel lift, because by lifting up the heel, you can allow that muscle to shorten a little bit with it as you're still walking on it. You're still going to get some movement all the time with it, but you can take some of the pressure off for a few days. You could put like a compression sleeve on there. You could do some ice on there. And then as it starts getting better, you can just keep taking that heel lift lower and lower and lower in order to take the pressure and regain the mobility of it. Gradually working in strengthening with it, gradually get back into whatever your activity is. So that's another thing you might look at with the Achilles. So we covered what? Achilles tendonitis, and some plantar fasciitis. What's another common one? Have anybody had IT band syndrome? IT band? Okay, so IT band refers to the iliotibial band that comes into the lateral part of the knee and attaches right here. As it comes up, it starts off as a tendon, and it comes up right about where your pants pocket would end. It becomes a muscle. It's called your tensor fascia lata, this TFL, and it attaches right here and a little bit into the gluteus maximus, the biggest part of your butt muscle. Okay, so there's two insertions for the IT band. If either one of these two things are compromised, the lateral hip musculature or the gluteus maximus, you can start having IT band issues. If either one of these are either weak or unstable, and you don't have the strength, and you start putting in miles, and say you're 6 miles into your run, and all of a sudden I start feeling this knee pain, one of the things I would look at is what is the endurance of your stabilizing muscles with this. If all of a sudden your endurance is right here, and you don't exceed it, you go 5 miles or less, or 4 miles, you never exceed it, no big deal. If you all of a sudden you exceed it, and all of a sudden your muscles aren't able to stabilize your hips, and your hip starts to drop, or it starts getting tired and wants to go into spasms, and it gets tight, it's going to pull this IT band tight right on the lateral structure, and the outside of the thigh, which is called your femoral head of the head of the femur right here, it will start to snap over there or rub on it. At about the knee at about 30-degree angles where it's going to have the most pressure, so you can almost get a snapping whether you go to straighten or to bend it right there. And it will start to rub back and forth and give you a lot of pain with it. So ideally, people would say, oh, the first thing you have to do is we have to stretch the IT band. So to stretch the IT band means you can't really stretch the tendon very much. You tend to have to stretch up here more. So the way you want to stretch, if it's on that side, is you go into a crossover step so that your one that is injured is in back, which means the muscle has to keep going over that hip bone right here, your greater tuberosity of your femur, and you drop the hip down, which you should already start to feel the stretch. If you're not, you could raise up and start pulling the slack this way as well. And this will go through and stretch out the IT band with this. This is the easiest way to stretch it, is just to go into this position right here. With the thought being that if you could lengthen this muscle, then you could put less pressure on where it's snapping. But that's only if it's tight. If it's weak, or if the glutes are weak, then it's going to present like an IT band. So sometimes you have to go a little bit further. There's can be a lot of reasons for an injury. Sometimes we say, oh, yep, I hit it or I strained it, and you know exactly what you did. Other times you might say, well, what is my shoe wear in this case? Are my shoes losing? I'm always running with my shoes with a little bit of a supination or a little bit of support with it. As they start to get 200-300 miles on it and they start to collapse, when your foot starts to drop, your shin will turn in. As it turns in, it's going to put more stress on your IT band. Could it be something where you have glute weakness with this? The glute weakness could present as hamstring pain. That's a very common thing with it, because if you go to stabilize your hip or to extend, and there's two muscles that typically extend, it's going to be your glutes and your hamstrings. If you don't have good glute strength or endurance, then your hamstrings end up doing more. You feel like you get an overuse entry. Oh, my hamstrings are just always tight with this. It could be really more of a glute issue with it. So a lot of times we have to look at a lot of different things. I mean, you need to look at shoe wear, how much support you're having, how often you're changing your shoes. The first thing I always look at, and Michael's heard me say this before, when did you change your shoes? Anytime someone's injured, I always say, when did you change your shoes? What terrain are you running on? Terrain is really important with it. Soft terrain, whether you're running on pine needles or whether you're running on trails that are a little softer, have a lot less stress on your body, and they force you to take probably shorter strides. If you get on a treadmill, it has some give. It probably puts you on a little bit softer, and it's always perfectly level. You start getting onto the roads, harder surface with it, or a walking path that's got a lot of indentations or divots in it, or you go into a county road that is crowned, things like this. If you're always running against traffic, that means your left side is here, your right side is here. I had an issue where I thought I had an issue with my ankle. It was that we were always running against traffic, and my big toe was dropping down further on my right side and making my big toe, my flexor hallucis that comes right behind my ankle, have to work harder. we started switching sides of the road all the time, and it went away just in a matter of a week. And it was just because of the crown of the road. Things like that, you know, if you're running on the high side, your high side is taking all the stress. That knee's taking the stress, that hip's taking the stress, that side of your low back's taking the stress. So the crowned roads, I would just encourage people that if you're running crowned roads, try and do it where you're rural enough that you can switch sides a lot and just be conscientious of the crown of the road. Same thing we've talked about even with the track before. If you're going to do speed work on the track, mix it up and go the other direction. Because if one side's always on the inside, you're always going to be working that IT band a lot harder than the other side with it. Those are just common things that if you just haven't thought about it, once you think about it, you think, oh, that seems easy. But it's just, sometimes you just have to be aware of it. I think a lot of times people think that they can outrun the pain. You know, you can have an injury and feel like, well, if I can just run through it, I'm going to get better with it. But I think the key is to listen to what it is, figure out what it is. Is it shoes? Is it terrain? Is it muscle imbalance? Is it I have a tight structure? I have a weak structure? Strengthening, I think, is a really important aspect for anybody that's doing any kind of endurance training with it. Anybody that's going to do triathlon events should be doing core strengthening at least twice a week. So when we say core, we don't just mean where you're trying to get a six-pack. That's the rectus abdominis in the center that runs up and down. We're talking internal and external obliques, which are on the sides. We're talking the multifidus in the back. We're talking glutes, hamstrings, quads, gluteus medius and TFL, all your hip flexors, and all your lateral stabilizers. It's the core strengthening. Think of cylinder, and it's the cylinder basically from your knees to about your mid-chest, because that's going to control everything from your lean to your sway. You know, if you've ever run by somebody that has maybe a little bit of weakness on their lateral hips, and you're running side by side, you'll notice they'll typically start to drift a lot more. They'll kind of be in that, and that most of the time that's because of just that lateral stability. When they stand, when they go to lift one foot up, they drop. They have to drop because of it. You'll see this with people walking all the time. If you're just, my wife probably gets tired of me doing gait analysis all the time because that's what I do all day. But you'll see people that'll have a weak right outer hip here, and you'll see if I have a weak outer hip on my right, the musculature here. If I lift up my left foot, I have two choices. I can either drop down like this because it's not strong enough, or I can cheat, and I can, instead of making this fire, I can just move my center of gravity over so that I don't have to fire it. So that's what people do. You don't see people walk and drop their hip like this when they walk. What they do is when they weight bear on their weak side, they lean over it. You see people walk all the time like this. That's almost always because they got a weak side right here. A person's had a hip replacement, we've made an incision here, and we cut through some of those muscles with it. You'll see them do this. Or if their body weight exceeds what their strength is, you'll see this all the time too. So just some general what I think are kind of intuitive exercises would be good for this. Elastic band or ankle weights tied around your ankles, going forward, going out to the side especially, going backward. These type of exercises are really good. Getting an elastic band, tying it around your thighs, at the bottom part of your thighs, going into a partial squat. So you got your glutes and your hamstrings activated with this, your quads are activated, and then doing small side stepping. It will burn like crazy on the outside of your hips with this. But this is the kind of thing that as you do endurance with this, it will get you stronger and stronger. And those are the things that when you go to power up a hill, you can hold your form with it instead of getting sloppy and then getting tired and then getting injured. So, you know, things as easy as just going through and doing as an active stretch to get warmed up, just coming through and just doing some squats where you're going through keeping your heels down, feet about shoulder width. You're starting to get your back limbered up. You're doing a little flexion, forward bend with your back. You're getting your glutes and hamstrings firing, your quads firing, and I'm stretching my Achilles because I'm trying to keep my heels down the whole time. Another one would be just standing and just going on your toes and back down. Seems easy, but if you don't have the ankle motion and the ankle strength to do this, how are you going to push off all the way on your gait? Single leg squats, great, easy strengthening exercise. Swimmers, especially with the recovery phase, shoulder retraction and protraction. It's really easy exercises to be able to do. And you think, you know, being a swimmer, you know that, you know, this seems like, well, how hard can that be? And do 20 of these and see how you feel. You feel like you're worn out.
Actually, corner stretches fixed my shoulder injuries.
Exactly. It's muscular imbalance. You know, the same thing is even in just coming all the way up. Your scapular mobility. When you go to raise up your arm, it's supposed to go to 180 degrees. 120 of it comes from the glenohumeral joint. The other 60 is because of your scapula. So if you have scapular tightness with this, then you'll be limited, even though your shoulder joint might be okay. So coming up and just doing an active, keeping your shoulders retracted back. When your shoulder has your shoulder blades with your scapula actually come up and they form the roof of your shoulder too. So if your shoulders are rounded forward and you try to raise your arm like this, you can usually go 20 degrees less. If you pull your shoulders back and you come up, you can go about 20 degrees more. Because all you've done is you've pulled your shoulder blades back, which means this top roof you've pulled back out of the way to give clearance to be able to come back. So those things, I'm just doing an active stretch where you're coming up, like a jumping jack type movement, but trying to not just come in here like in front of my head. I'm wanting to pull my shoulder blades back to stay in the plane of my ears to get that flexibility. Okay. Have I hit on anything that anybody else has questions on?
Can you comment on like piriformis injuries or piriformis stretches?
Yeah, absolutely. So piriformis is a muscle. It looks like a hot dog, literally like a hot dog. I mean, it's the exact size, the exact diameter. It goes from the tip of your tailbone, about half an inch up from the tip of your tailbone, and it goes right to the ball of your hip, right here. And it's right there. So you can palpate it, feel it. If you sit and rub back and forth, you will be able to feel exactly where it is with it. It is an external rotator of the hip. And so one of the ways that if you're going to stretch piriformis, piriformis injuries typically come because of it's trying to compensate for something else. Usually weak glutes, the buttocks muscles with this, or weak lateral stabilizers, which again, where I might try and do some of the sidestepping or lateral raises with it. There's several ways to stretch it. My favorite way is if you're lying down, is to try to pull knee to opposite shoulder, and once it's the opposite shoulder, because then I've already taken out most of the slack, I can just fine tune it by just pulling this across my body just a little bit more. So if you're at a table, somewhere where there's a table, you could also do this and come forward. Because I'm going knee to opposite shoulder, and then I'm pulling this on across. But if I were going to lie down, I think that is the best way to do it. And I would always go with my same side hand, I go pull my knee to my opposite shoulder. And that does about 80% of it. I get really almost all the slack taken out. Then as I go to cross over, you will feel it immediately right there. Other things people will do is they'll use some of these other devices. Have you guys seen foam rolls? Some people have said they've used it. Foam rolls can be used for lots of stuff. Everything from stability exercises, core stability, if you're lying on them. You know, people will go through and do things where you're lying on them like this, and they'll try to balance and go one foot up and the other foot up, and just having used their core for all of it. They'll try to do what we call dying bug exercises, where they're lifting opposites to do this, and the slower you go, the easier. So I'm making it easy or the faster you go, the easier, which is what I'm doing. Other things you can do if you have tight paraspinal muscles, you can, or like if you have a rib, some people complain about having either a tightness that pulls the rib or a looseness that allows the rib to slip, and they feel like they got a rib anomaly with this. in the back, your ribs kind of come up and around and out. So as they do this, if you have a rib that's out of place, it will typically do this. So you'll feel, and then there will be a lump or a step where the rib is. So one of the things you can do with a foam roll is you can cross your arms, get your scapula out of the way, and just gently roll to one side or to the other, and your body weight puts all the pressure on the ribs, so the one that's back gets pushed back in. Very easy, very easy. And if you feel like you have like a entire vertebra with the rib that's pushed back with it, you can go perpendicular. You can raise up this way, again, cross. You gotta relax and exhale. You can just change the angle by raising and lowering. Crack, crack, crack. It's literally that easy. And you're gonna feel like you just went through all your mobilizations. When you're perpendicular and you're going back and forth like this on your back, it makes all your muscles get relaxed. When you go this way, it tends to go pop, 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 and do that. Other things that you can use this for, other than the core stabilization stuff, or then some of the spinal mobilizations with it, is what you're talking about with like piriformis or some of the other muscles. You'll see people do this all the time, like for a hamstring. They might start off doing both hamstrings at once. And typically what you're gonna do, say start with calves. So like after a bike, you typically are wanting to push all your swelling this way. So the rule is that you go 2 inches up, 1 inch down, 2 inches up, 1 inch down. So you're here, and if you think, oh, that seems pretty easy, instead of having twice as much pressure, instead of having however much pressure, having halved, you could switch and do this. Now I've got all the pressure on my left calf. 2 inches up, 1 inch back. 2 inches up, 1 inch back. 2 inches up, 1 inch back. And while I'm on that muscle, I can roll. I can be rolling back and forth on it too. And so I'm basically doing like a self-massage of this. And it should probably take you about 4 or 5 minutes of going one leg with this, and then you switch and do the same thing on the other side. You can go on your stomach and you can do your anterior tibialis muscles. You can go on your hamstrings with this. Again, you could start off doing both of it. You think, oh, that's pretty easy. You could switch and go on one. You can go through and do your IT band with this. Again, 2 inches up, 1 inch back. 2 inches up, 1 inch back. 2 inches up, 1 inch back. And the whole time you're kind of rolling it back and forth. If you get onto a point that seems like it's sore, like a trigger point, you can get on that area with it and you can just hold. And often what you'll find is within 10 to 15, 20 seconds, it will just release out. And then you can just easily come back on it. The first time you do this, it's very painful because you're just not used to it. And then as you do it more, it gets easier and easier. And then same thing with like even your IT band. You'll see people do it where they're doing IT bands all the time with this and coming up into their lateral quads or going onto their stomach and they're doing their quads this way after a bike ride. A couple of the really easy things I like, a lot of people bike, so a couple of the easy things we've talked about with biking too on recovery is to do just an adductor, just a hanging stretch with it after a bike ride, and your legs typically tend to fill with blood afterward and feel kind of swollen. Just to lie on your back, have your legs up like on a wall, everything will want to come down, and as you keep getting closer to the wall, you'll get your hamstring stretch at the same time. So 5 minutes of that is a really nice thing to do after an aggressive ride. But yes, you can use this for the piriformis. This is the other thing. Have you ever seen one of these? These are about 40 years old. They're called a Theracane. And there was a guy that had it's more for like trigger point relief and massage. They come with books and everything with it, but they can be used to do deep pressure point relief type things. And you can use these different points along here for different parts. Like most people, if they're doing a lot of cycling, will typically get some in like their levator muscle or their rhomboids through here, their back, they get buttocks. And what you basically do is that you try to pinpoint, kind of put that muscle on stretch a little bit and find the area where you have the soreness with it. And you can go through, and once you find the knot or the point, then you can put some pressure on there, some sustained pressure, and then you can even go through and just it allows leverage on here, and it allows you to get into the knot and very easily reach points that you can't get to otherwise. And these are really, really nice. I don't know if you've ever seen it, but you can use them on your back, and they allow incredible amount of leverage. So that's one of the things that a lot of people like with it. On the hip and knee pain, you typically are going to see more females have a lot more hip and knee pain, and that just because it has to do with the hip angles with it. So I think that's something else that people have to look at, is that requires a lot more strength whenever there's a bigger angle coming in with it. People 30 and under typically have more stress fractures. Again, it's building up their muscles with it, whereas olders have more muscular injuries, and the youngers typically have more stress fractures with it. So I think the key for most people is to start right, identify what your weakness is. Everybody's got weaknesses. Everybody has ways that they can improve, whether it's they need more core strength, they need more flexibility in a certain area, they need a better training path, they need better nutrition or nutritional tolerance. Everybody has some type of improvement. Finding out what that is and gradually working into those.
I have a question.
Yes.
Okay, so what is the proper mix, balance, whatever, of stretching? In other words, as long as everything stays strong and nothing gets injured, you don't ever seem to feel the need to stretch. As soon as something starts to hurt, then all of a sudden you go, oh gosh, I should have been stretching all along, or I gotta stretch now. But where should it come into play? Because I've read some theories that stretching's not beneficial to the muscle.
The last studies, the most recent ones that have been done, they say there is no benefit of stretching prior to running.
Okay.
There's no decrease in injury for people that stretch prior to running, but they found that there is decrease in injury in people that stretch after they've run. So if what they would suggest is with running, that they would suggest that you start off with like a walking or some drills, whether it's your skipping or your high stepping or whatever your drills are, to work into it. And once you feel like your muscles are activated and warmed up, that's when you go into your actual run. But then the stretching is, again, what is your area of weakness? So if you are already loose in an area, you probably don't need to do a whole bunch of stretching in a certain thing. If you have lax shoulders and you're going to be a swimmer, you probably don't need to stretch your shoulders anymore, because you're only going to increase your instability. In that case, I would look to say, let's just do lots of rotator cuff strengthening. Let's do a lot of scapular strengthening with it. Let's do lots of work on where you can, get as much internal rotation strength for your pull. I don't think that every person needs to stretch. I think it is person to person how you're put together with it. Like we always talk about in the therapy world, everybody has a certain amount of strength and a certain amount of flexibility. And you don't want to be necessarily the strongest, and you don't want to be the weakest, and you don't necessarily want to be the tightest, and you don't want to be the most flexible. Like the people that typically are the best are the people that are in the middle on both. So you have to identify where you are on each one of those. If you're the strongest person, you probably need to not worry about that and worry more about flexibility. If you're the really flexible person with it, then you need the stability to be able to benefit from it. So I think it's a very person to person with it. If you find, like, if you say, well, I'm having a consistent hamstring pull, why is that hamstring? Is it because maybe your Achilles are tight and we need to do Achilles stuff so that you're not having to pull through, and so that is it that you need more calf strengthening because you can push off with it instead of having to pull through with it? That's where it usually takes kind of digging a little deeper with it. But I don't think every person needs to stretch. In fact, they say that if people have consistently been stretching prior to their runs, they should probably keep that up until they're done with their next race or their next interval. And they shouldn't just go cold turkey, well, I'm going to quit stretching. Because the theory is that if you always stretch your hamstrings, then your hamstrings are used to being loose, and then as you go 8 miles into your run, they're really loose. If you start off tight, then they're not used to those first 4 miles where it takes to get loose with it, and then you're going to have injuries during that first 4 miles because you're using different biomechanics. So, what do you guys think? Anything else you want to talk about?
Do you think there's any long-term issues with running?
No.
Okay.
I think there are.
Or anything for that matter. Like, I mean, is there just like
no increase in osteoarthritis, which is the thing you're constantly going to hear is, well, you've been a runner for that long, your knees are going to be shot. There's absolutely research says no correlation with it. For one, you typically keep your body weight lower than what it would have been otherwise, so that could be the offsetting contribution for it. Everything else tends to be better. Your blood pressure tends to be better. Your cholesterol tends to be better. You're less likely to have diabetes. There's less stress, less anti-depression, anxiety medicines, all the other things that go along with the benefits of running with it. No, I think the pros definitely outweigh the cons, assuming that you're listening to your body and you're trying to do it for the right reasons, not just for this is the time. Like I have to meet this time for this goal. If you can be flexible with those things with it, treat your injuries early, those are the keys with it, and then people, I think it's absolutely beneficial for it.
Can you interfere with your mental and
You're right. Good. So, some of the core strengthening things, I think, that I just jotted down, like if you're in the weight room, bench press, chin-ups, where you're on your buttocks and you're doing the knee tucks, where you're here, and you're just coming up, is a good core strengthening. Those are all ones where you're using a lot of big muscles. Step-ups with weight are very beneficial, good way to build strength with it. Leg curls, if I was going to do leg curls for hamstrings, if I had the choice, I'd always do them lying down on your stomach, prone, so that you're getting more of a stretch with your hamstrings with it as well. Calf raises, I think people just kind of overlook calf raises and think, but the strength of your calves are really important with it. Planks, prone planks, sideline planks, bridging, and all the progressions that go with those, where you're going from a shorter plank to a longer plank, or you're going from 2 feet to 1. As you get good with doing prone planks, then you just add in your arms, and it's called push-ups. But if you see people get fatigued doing push-ups, what do you typically see? Their arms are still going up, but they're having a hard time getting their trunk up. It's because their core strength is weaker than their triceps or their chest. So I think all those are good examples. Hamstrings. So I think those are kind of the things I prepared to talk about, but I'm happy to talk about it if there's anything else you guys want to talk about.
Yeah, shin splints is something that like me a lot. Did I hear you say if you watch where you land on the foot, that's going to take care of a lot of that?
Yes, one of the things, shin splints is another term for anterior tibialis overuse, or it's an eccentric control. What you'll typically see with people that have shin splints is increased hill work, especially declines, more than what they're ready to decelerate with it, and flip-flops when they're not running. Because flip-flops force you to have to control that on every step with it. You see tons of track athletes early in the season when they're doing all their sprints and they're controlling their foot slap, that they typically get it early. Soccer players almost always get it early in the season with it because they're running a lot, and as soon as they're done, they take off their cleats and they put on flip-flops. And flip-flops are like probably the biggest thing I see with it. And then there are some nice socks like those, we use Zensa a lot, but there's the
Ininjis? You talking about like the 5-finger?
Like the CP.
Oh, compression. Sorry,
yeah,
got it. Okay.
Like those compression socks that just go on that area. That's exactly what they're for too, and they work really well because they kind of keep you where you don't have as much vibration when you're running. And we use them even a lot for like recovery as well. So like if we work out in the morning and you feel like you've had a run or something, you're going to bike that evening, and you want to have some compression so your legs don't feel swollen during the day. They're really great to wear for that too. They're not terribly expensive, but they last forever, and there's only a couple sizes with them, so they're very easy. Good.
Yeah, that was great.
Okay.
Thank
Ready,
you.
Brad?
Yeah. Who wants to run?
No?
I say everybody with Newton going can run.